All right, and we are live. Welcome to another weekly webinar from Premier Physical Therapy. I'm just doing another check to make sure I'm posting this to the right page. All right, looks like we're good. So today's topic is jaw pain. My name, of course, is, if you haven't seen one of our weekly webinars before, is Curtis Pachoka. I'm one of the physical therapists here at Premier Physical Therapy. I graduated with my doctorate in physical therapy in 2015 from University of North Florida, and I recently received my orthopedic board certification in July. So a little bit about our clinic, if you haven't been or heard of us. It is a local PT-owned clinic. We have two locations, one in Jacksonville Beach area near Beach Boulevard and Hodges, and another located in Ponte Vedra near Fairfields and Palm Valley. So the specialties that we offer are orthopedics, TMJ, and facial pain, which we'll discuss today, lymphedema, running, and golf programs. So the jaw is a versatile joint. Some of these pictures here can be used for eating, singing, talking. So this joint is the most used joints in everyday life because we're talking every day, we're eating every day. So it's used quite often. A little bit basic anatomy. If you can see this picture here, you have your skull, and then you have below your skull, you have your mandible. Easy way to remember this is the mandible makes the man. So if you have a very defined jaw, that seems to be more testosterone or more manly. So that bone is called the mandible. You can see some of the muscles that are attached there. The masseter muscle used for closing your jaw for chewing. You have your temporalis muscle, also can be used for closing your jaw or pulling your jaw backwards. Then you have the joint here, the temporal mandibular joint. Uh, and oftentimes when you go to get this treated, a lot of people will say, I have TMJ, I have a TMJ issue. And once you have pain, because everyone has two TMJs, so once you have pain or dysfunction in your TMJ, they refer to that as TMD or temporal mandibular joint dysfunction. So a little bit of the joint dynamics. You have an articular disc between your mandible and temporal bones. Uh, the head of the mandible rolls forward and then slides forward with the disc. So when this disc is made of fibrocartilage, which is a very tough material. Other joints in your body, like your knee or your hip, are made of articular cartilage. So the articular cartilage, such as your knee arthritis, it's a very smooth marble-like material that helps the joint slide. This fibrocartilage is very tough fibrous tissue that's very durable, which is perfect for your jaw because you're using it so often throughout the day. Um, this picture is a little bit small, but what happens is when you open your mouth, this condyle here, which is part of your mandible, will roll forward or backwards and then slide forward, carrying the disc with it until it reaches this section right here. A lot of times we'll discuss later, one part of jaw pain could be your disc is in an area where it shouldn't be, it's displaced. Um, and what that happens in this starting position, instead of your disc being right above this condyle, it's actually forward and it's stuck forward. And then when you open your jaw, it'll reduce back in some cases and make a clicking sound. So, some common jaw complaints. You could have clicking, popping, catching, and locking. You could have a limited range of motion. So, if it's difficult to open your mouth or to move in certain directions, eating is going to be really difficult. Pain, tension, fatigue, and then some of the activities that can be troublesome. Yawning, you have to open your mouth very wide to yawn. Dental care, you have to keep your mouth open for long periods of time. Talking, singing, playing any instruments, and then sleeping. So, some less obvious complaints that could be related to your TMJ joint are headaches, ear symptoms, ringing, painfulness. As we'll discuss later, some muscles can refer pain to the ear or in front of the ear. They can also refer pain to the teeth. You can have difficulty swallowing, numbness, tingling in the face, which we'll discuss in the upcoming slides, neck pain, and feeling that your chewing or your bite is feeling off. So, jaw, head, and neck connection. This is very important because you cannot treat jaw or TMJ pain or dysfunction without also treating your neck because your jaw connects to your skull and then your skull sits on top of your neck. So if your neck is in a strange position or it's weak or your posture is bad, it's going to make using your jaw very difficult. Also, muscles can refer from your neck. As you can see in this picture, this is a neck muscle called your sternocleidomastoid. And even though you can have trigger points in this muscle, you might not feel it at the muscle. You might feel it in front of your ear. You might feel it around your eyebrow, maybe a little bit in the jaw too. So you can have a couple different problems with the TMJ. We'll discuss this later, why an examination is important, but one of the issues could be the joint itself. You have ligaments and capsule around the joint, and then the disc that we talked about is located in that joint. Uh, so you could hear some loud popping sounds. When you open your mouth, it might not be able to open symmetrically, so you can have what's called a deviation when you open your mouth to one side or the other, and it could be limited in trying to open your mouth, and it can get stuck. It could be either stiff, moving too little, or moving too much. Um, Rheumatoid arthritis could affect this joint. Some people need to get surgery for this joint, and you could have an accident or trauma to the joint too. Muscular issues. So the three issues we're really going to talk about is, and part of the exam is to identify what we need to treat. Is it could be coming from the joint, like we just talked about. It could be coming from the muscle, and then it could be coming from the disc itself. So with the muscle, you can have trigger points, which are tight little taut bands of muscle that refer pain to different areas of the face. So as you can see this picture, you can see the masseter muscle, maybe the medial pterygoid behind it. But when you have a trigger point, it can perhaps refer to inside the ear, in front of the ear, above the eyebrow, on the top row of teeth, and the bottom row of teeth. So even though you're having pain in your face, it could be caused from muscle tissue and maybe not the joint itself. It could be caused from overuse in some of these parafunctional habits or activities, such as bruxism or grinding your teeth at night, um, chewing gum, chewing ice. With these muscle problems, you can have a loss of coordination too. So when you open it and close your mouth, it might not be a smooth motion. It might be a little shaky or uncoordinated, and that could become a problem. And you could be resting your the resting position of your jaw could be improper. So we'll discuss that a little bit in the upcoming slides too. Let me just take a break here and see if there's any comments. Let's see. Yeah, if you have any comments, just post them in the comments section. See if there's any so the next issue could be some nerves. So you can have neuralgia, nerve pain due to irritated or damaged nerve. The most common under the current topic is trigeminal neuralgia, which supplies sensation to the face and motor control for chewing. So it has three branches here, this trigeminal nerve. You can have the ophthalmic branch up to the eyebrow area. You can have the maxillary branch going to the top row of teeth in the cheek, and then the mandibular branch goes to the jaw, even inside the ear and a little bit below the jaw. Irritation or damage can cause severe facial pain, even with low stimulation. So it can be really sensitive. And you can also experience changes in chewing and coordination if this nerve is affecting the motor control. So, what can I do about my pain? So, when you first have pain, everyone always wants to wait to see if it goes away. I do the same thing. Um, and then, if it starts to not go away, you start to change things before actually going to a professional or going to a doctor. So, you might try to modify your diet. If you're having difficulty chewing, you might choose to stop eating foods like apples and switch to smoothies. So you're modifying your lifestyle. If you have pain going to the dentist, then you might, not go as often. Um, if you have pain with playing instruments or talking, you might, or even eating out, in public, you might limit your socialization. So, what can I do about my pain? Alter it and mask it. So, ways to alter it and mask it would be some injections, pain medications, ice, heat, TENS unit. But as we'll talk about later, these aren't really addressing the cause of your problem. They're just masking it. So, what can I do about my pain? The best option is to try to figure out what is causing your pain in the first place, because just masking it won't solve that problem. And so you're only kind of delaying the inevitable of it still causing you problems and eventually leading to seek a professional in the future about this. But then if you wait too long, it could be harder to fix, then you might require surgery. So it's a lot more cost effective and it'll help you recover faster if you seek a professional early on. Um, Less side effects, physical therapy compared to medication and injections. We specialize our treatment plan to the individual. So everyone's treatment plan is completely customized based on your first day appointment and what we find. We'll teach you ways to self manage and maintain your progress and your gains independently. So you don't have to rely on, as we mentioned, medications and injections and surgery. And we make sure we're as honest to you as possible using evidence based research on what things are effective in improving your function, your range of motion, your pain. And we want to use the best research uh, and share with you the best research on what's going to help you. So, what is included in PT for my jaw? So, like I talked about, custom, individual plan, evidence based, based on the best research. What are the most important parts of your life that you are having difficulty with due to your job pain? So we want you to be part of the process. We want you to have control and to feel like you're involved in your treatment plan. So the first day we ask you, what things are most difficult for you? Is it sleeping, eating, socializing? What matters to you the most? Because we want a treatment plan to fix what you're having the most trouble with. So if you don't really mind say you have maybe not too much pain, but you're just having difficulty eating apples, then we're not going to have a treatment plan just to resolve pain. We want to make sure your range improves and your strength improves so you can eat your favorite foods. Is just one example. So we also have hands-on treatment, which is extremely important for the TMJ joint because, like I talked about earlier, you need to treat the neck because the head sits on top of the neck, and then your jaw is connected to your skull. So if you don't have a therapist who knows how to treat your cervical spine, you probably won't have optimal recovery uh, from your TMJ pain or issues. So examples of some of our manual therapy include joint mobilizations, soft tissue massage, dry needling is coming soon. We have approval to do it in Florida. So we have a therapist on staff that is already trained in dry needling also. So what is included in PT for my job? We also have exercises for recovery and management maintenance. So we have mobility exercises, strength, coordination. We'll teach you about your proper resting position, teach you how to reduce some of those parafunctional activities such as grinding your teeth and improve your posture too. So one example of posture is the sitting. You don't want to have a slumped posture while you're sitting. And in another picture, this next one here, this is a little bit more ideal. You want to set your ergonomic workstation to, these dimensions here. You want to have your hips at 90 degrees, knees at 90 degrees. You want to be touching the floor there. You want your elbows on a rest, reaching the keyboard. You want your laptop tilted at an angle facing up towards you, about 10 to 20 degrees. You want your eye level to be at the top of your computer screen. And then, of course, switching it up from sitting to standing is a very good idea. But also taking walking rest breaks every 30 minutes to an hour is also a good idea. Sleeping position, if you sleep on your stomach, it's very not recommended. Not only does it put a lot of lordosis in your low back and cause back problems, your neck is rotated all the way to one side. So you could be stretching one set of muscles and shortening the other set of muscles, making your neck asymmetrical. Also, you're putting a lot of pressure on the chin, which can put a lot of stress on some of your TMJ ligaments and muscles and capsule and all sorts of tissue. So the proper resting position, you might find yourself that you're not in this position. So normally when you're resting, the tip of your tongue is up and it should be touching behind the two top front teeth. It should be resting right behind those teeth. Your teeth should not be touching each other. They should be apart. So if you're resting right now and you feel like your teeth are constantly contacting each other, that is not a good thing. And then your lips are closed. Some people are mouth breathers and they keep their lips open, but that can be a problem because not the ideal resting position. So the goals of therapy, physical therapy, are to reduce, abolish your symptoms and to gain your independence and helping you manage and maintain your progress that you gain through us. So now decisions have to be made. If you yourself have jaw pain, tooth pain, ear pain, neck pain, facial pain, or you know a friend that does and they've never had physical therapy before, you could come into the clinic for an evaluation. We can determine if it's a physical therapy problem, if it's coming from your muscle, your jaw, or your disc, or your neck. or your nerves. And once we determine that, we can determine a treatment plan for you. Another option, you could schedule a consultation through a telehealth evaluation, but not all insurances will pay for this. So please call the clinic prior and have your insurance benefits run. Or you can start with the freebies we provided you today. We gave you some education on some of the resting position and postural changes and sleeping changes. Start with that, see if that gets better. But if it doesn't, you might need more than that. So we have our email here, info@Premier PT Jax. I'm gonna once again check some of the comments here to see if there's any questions. Let's see. Check in the comments. If there's no comments section, then it is Friday. Let's take a break here and see if there's any. Let's Looks good. So other than that, I'm out of here. Thank you again for joining our webinars. This will be on YouTube later, so check out our YouTube page and put any comments on our YouTube channel too. Also have some postural. We have a postural series. Since we talked about posture in this video, we have a whole postural series on our YouTube channel that you can already watch on setting up an ergonomic desk station. But other than that, have a good weekend, and we'll see you next week for another webinar.